How do BRAF, KRAS, MSI mutations affect colon cancer drug response? Imagine your body's cells as tiny factories, each with instructions that tell them how to grow and work. Sometimes, these instructions get altered due to mutations, which can change how cancers behave and respond to treatment. In colon cancer, understanding these genetic changes is crucial for choosing the best treatment options. That's where molecular testing comes in. When doctors analyze a tumor, they look for specific mutations like BRAF, KRAS, and microsatellite instability, or MSI. These details are included in pathology reports and help guide personalized treatment plans. Let's start with KRAS mutations. KRAS is a gene that helps control cell growth signals. When it mutates, it can turn these signals on all the time, making the cancer grow unchecked. If a tumor has a KRAS mutation, it usually does not respond well to certain targeted drugs called anti-EGFR therapies, like cetuximab or panitumumab. Because these drugs work by blocking growth signals, but KRAS mutations keep those signals active regardless, the drugs become ineffective. So, testing for KRAS mutations is standard before starting these treatments. If the mutation is present, doctors often choose other options instead. Now, BRAF mutations are less common but very important. The most studied BRAF mutation is called V600E. Tumors with this mutation tend to be more aggressive and have a worse outlook, especially if they are microsatellite stable. These BRAF mutant tumors often don't respond well to standard chemotherapy alone. However, targeted therapies that inhibit BRAF and MEK proteins have been developed. These drugs can sometimes improve outcomes for patients with BRAF mutations, especially when combined. But response rates vary, and not everyone benefits equally. It's important to note that BRAF mutations can also influence prognosis, but their impact can be different depending on the tumor's MSI status. Speaking of MSI, or microsatellite instability, this refers to a defect in the tumor's DNA repair system. When the repair system is faulty, many small mutations accumulate across the tumor DNA. Tumors with high MSI, called MSIH, have lots of mutations, which makes them more recognizable to the immune system. Because of this, MSIH tumors tend to respond well to immunotherapy drugs like pembrolizumab and nivolumab. These immune checkpoint inhibitors help the immune system attack the cancer more effectively. On the other hand, tumors that are microsatellite stable, or MSIs, usually do not respond as well to immunotherapy. Interestingly, MSI status can also influence how other mutations affect prognosis and treatment. For example, BRAF mutations tend to be associated with worse outcomes in MSI tumors. But in MSIH tumors, the negative impact of BRAF mutations is less clear because MSIH status itself is linked to a better prognosis. Similarly, KRAS mutations consistently predict resistance to anti-EGFR drugs, regardless of MSI status. So what does all this mean for patients? Molecular testing for BRAF, KRAS, and MSI has become a routine part of diagnosing colon cancer. Knowing these details helps doctors decide which treatments are likely to work and which are not. For example, if a tumor has a KRAS mutation, anti-EGFR therapies are usually avoided. If it has a BRAF mutation, targeted therapies might be considered, especially if standard options don't work. And if the tumor is MSIH, immunotherapy could be a promising choice. It's important to remember that these mutations are just one piece of the puzzle. Treatment decisions depend on many factors, including the stage of cancer, the patient's overall health, and previous treatments. Ongoing research continues to explore how these genetic features interact and how new drugs can overcome resistance caused by mutations. The goal is to personalize therapy further and improve outcomes for each patient. In summary, BRAF, KRAS, and MSI mutations are key biomarkers in colon cancer. They influence how the disease behaves and how it responds to different treatments. Testing for these mutations helps ensure that each patient receives the most effective, personalized care possible. Always consult with your healthcare team to understand what these results mean for your specific situation, as medical science is continually evolving to provide better options.